Hello everyone, I am Dr. Vaishali from Dental Academy and I'll be teaching you about development of teeth. Development of teeth is really important क्योंकि ये last 10 year में हर question paper में इस topic से एक question ज़रूर आता है. So then let's start with development of teeth. So development of teeth में दो major topic है, that is formation of dental lamina and the second topic is stages in tooth development. तो stages of tooth development में तीन stages होते हैं. The first one is the bud shape stage, second is the cap stage, third is the bell stage. Bell stage is further divided into early bell stage and late, or also known as the advanced bell stage. So we'll be talking about the formation of dental lamina in this video and we'll be covering the rest in the next coming videos. So where does the tooth development happens? Tooth development होती कहाँ है? तो जब as soon as the embryo is conceived, as soon as the baby is conceived, embryo formation में जो प्रिमिटिव माउथ होता है, जो कि हमारा डेवलपिंग माउथ है, उसके अंदर टूथ डेवलपमेंट स्टार्ट होती है. सपोजिबली दिस इज द डेवलपिंग एम्ब्रियो एंड दिस इज द डेवलपिंग माउथ, जिसे हम प्रिमिटिव ओरल कैविटी कहते हैं बिकॉज इट इज स्टिल इन द डेवलपिंग फेज, ऑल्सो नोन एज स्टोमोडियम, विच इज लाइंड बाय द स्ट्रैटिफाइड स्क्वैमस एपिथेलियम. इसके अंदर हमारे पास दो लेयर्स होती हैं and those two layers are the upper one, the ectoderm, and the lower one, the endoderm. जो ectoderm होती है which is connected with the endoderm with the membrane known as the buccopharyngeal membrane. This buccopharyngeal membrane on the 27th day of pregnancy ruptures, resulting in the contact of the endoderm to the ectoderm. जब भी ये कांटेक्ट होता है, एंडोडर्म एक्टोडर्म को एक सिग्नल भेजता है कि इट्स टाइम एंड लेट्स स्टार्ट द टूथ डेवलपमेंट. When the buccopharyngeal membrane ruptures, the ectoderm comes in contact with the connective tissue. ये हमारा connective tissue है beneath, जो कि ectomesenchymal in origin है. It starts to send signals to the ectoderm कि it's time to start the tooth development. So after 2 to 3 weeks, so let's go, after 2 to 3 weeks within the primitive oral cavity stomodium, there is development of primary epithelial band. The 6th week of pregnancy, जब ये horseshoe shaped structures हमारे प्रिमिटिव ओरल कैविटी स्टोमोडियम में बन जाते हैं, गेटिंग टू द बिगर पिक्चर है, जिसमें हमारा एक्टोडर्म एंड जो सबसे नीचे एक्टोडर्म के बेसल सेल लेयर होती है, दिस इज द बेसल सेल लेयर वी आर टॉकिंग अबाउट, स्टार्ट्स टू पॉलिफरेट. इस पॉलिफरेशन की वजह से नीचे एक प्राइमरी एपिथेलियल बैंड की फॉर्मेशन होती है एंड दिस पॉलिफरेशन लीड्स टू प्राइमरी एपिथेलियल बैंड. ओके, इवेंचुअली दिस प्राइमरी एपिथेलियल बैंड हमारा डेंटल लमाइना और वेस्टिबुल लमाइना फॉर्म करता है. When the primary epithelial band is formed, it is eventually divided into two processes, two parts, the outer part and the inner part. the outer part is the buccal process, whereas the inner part forms the lingual process. Buccal process forms the vestibular lamina, which forms the vestibule of mouth. Now, what is the vestibule of mouth? Vestibule of mouth is the part between your cheeks and your teeth. The space between your cheeks and the teeth is the vestibule of the mouth, which is formed by the vestibular lamina. So, and the inner part, which forms the lingual process, forms the dental lamina. So this is how the formation of dental lamina takes place. So once the dental lamina formation is done, it forms the ectodermal portion of the deciduous tooth. The permanent successors of these 20 deciduous tooth is done by the lingual extension of the dental lamina, and whereas the permanent molars are formed from the distal extension. What is the fate of dental lamina? एक बार दांत बनाने के बाद डेंटल लमाइना का होता क्या है? सो डेंटल लमाइना की टोटल एक्टिविटी हमारी ओरल कैविटी में 5 इयर्स तक दिखाई देती है, पीरियड ऑफ 5 इयर्स तक दिखती है. उसके बाद जो हमारा थर्ड मोलर रीजन होता है, उस एरिया में भी कई पोर्शंस में डेंटल लमाइना इज स्टिल फाउंड टू बी एक्टिव, एंड द रेमिनेंस ऑफ द डेंटल लमाइना परसिस्ट as epithelial pearls and filans within the gingiva and the oral cavity. ठीक है, within the jaw and the gingiva, and these are known as the rest of series. And these are the important question which comes up in the exam, कि what are epithelial pearl, what are rest of series, as short questions, 5-mark questions. The dental lamina shows excessive growth, and they are 20 in numbers. So they are known as placodes, which forms the 20 teeth, deciduous teeth, 10 in upper and 10 in lower. So these placodes are for the forms bud, cap and bell shape, which we'll be discussing in our next video. So stay tuned to Dental Academy for further such dental assistance. Thank you so much. Please like, share and subscribe.